Dr. Myron Cohen.
I remember watching CNN reporting about an outbreak of a deadly virus in China, and then it started spreading, soon touching down in South Africa. I then wondered how my hometown of Port Elizabeth would be able to cope with this threat.
We note the confirmation of a person who has tested positive for COVID-19 in our province. This person is a person who traveled to Germany recently. Now that the case has been confirmed, treatment protocols are kicking in, with the patient being quarantined for treatment.
63 more people have died, bringing the total number of deaths to 1,737. Almost 45,000 people have recovered.
It spread rapidly, making me anxious. I knew as a journalist covering the impact of this virus was now my responsibility. I was worried for myself and my family, and could I take this disease home with me? My first COVID-19 assignment was covering protesting nurses demanding PPEs. The danger was real, interacting with frontline workers, but the job outweighed the worries most days. But then it hit home, reporting from a COVID-19 ward at Livingston Hospital. My heart pounded as we approached the doctors to be interviewed. I thought I could sense the coronavirus hanging in the passages, but meeting a calm doctor, unmasked, surprised me. His story was one of heartbreak.
I definitely feel it. It's not nice to see people suffering, very short of breath and unable to get oxygen, or you struggling to find oxygen for them. And also knowing that a lot of these patients that are coming in are older, they have comorbidities, and the reality is they're not going to qualify for any escalation of care. And that's hard to accept.
The deaths are taking their toll on the healthcare workers. Doctors deal with it daily.
I'm sure a lot of people are aware of the studies that were done previously that showed that COVID used to affect the older population. It used to be the old, the older persons in the community. But now in our caring of these patients, we're actually seeing young people. We're seeing young people come in very ill with COVID-19 pneumonia, and we've seen people die from COVID-19 pneumonia. So it is actually very true for us, where in the past, when it started, we were like, no, it's all the older people who are, succumbing from the disease. Now you realize the amount of risk that you are at every single time you interact with a COVID-19 patient. You wear the PPE, and sometimes you wonder if you are wearing it, if the PPE is going to protect you from contracting the virus. But what else can you do? I mean, you went into medicine knowing that, some of these things may happen. But now when it gets real, you see your colleagues getting the virus, you see people around you getting the virus, then you realize that, the threat is real. One day I may have a cough, and the next day I may need a ventilator, and it may not be available.
The day in Livingston Hospital was the most harrowing experience on the job for me. It became all so real as I thought of my young daughter. I wondered if my desire to tell the stories would affect my loved ones. By June, the metro was in the midst of the pandemic. Field hospitals and quarantine sites were going up. The world-class Nelson Mandela Bay Stadium was one of the sites. And from it came a story of hope and love.
You don't ever feel like you are not in your own home. We arrived here and found others who had COVID-19. We worship together and we support each other. We are able to visit other rooms and we chat and have a great time. We also get to watch TV. The food is delicious and they are treating us so well, and many others are recovering. So I want to encourage others not to fear getting tested. When you feel symptoms, go and test so that you know where you stand and don't infect others, because that's why this virus is spreading, because people are not testing and others fear testing. But when you test, you can stay away from people, so it's nice to be here. We miss our families, but we call them daily, and we feel like we have gained another family by being here.
The survivors of the disease all talk about fulfillment, describing it as a victory. But some have a long-term battle to completely recover.
Pain where it's like, I don't know how to put it. It's like someone punched me, or I bumped into something, or I fell with my back. It's no longer that pain where I was feeling that pain that I was feeling before when I was positive. Now it's a different pain. It's a pain where I need to be, massaged or rubbed and get with those rubbing stuff, and taking every night. I have to take painkillers. I don't think I'm able to sleep without painkillers if the pain starts.
The disease also leaves a mental scar.
The one thing that actually is the anxiety and heart palpitations, and where I could, out of the blue basically, I could just feel that I'm just very anxious. And then I remember the day I went back to work, and then I started wearing a mask, and a mask that we actually wear at work, a cloth. So what happened was, when I first wore it, I could then feel that my heart was beating very fast, and then panic attacks also happened like that. So I think I actually got a panic attack.
As the days went into months and we continued to tell the stories, in the back of my mind I still feared contracting the disease, infecting my family in the process. And then it happened. It crept up on us. Myself and my family, now a number, COVID positive. The fatigue, chest pains and coughing became nearly unbearable. Couple that with medication, leaving you nauseous, it was a very rough ride. We are now recorded as a recovery, one of the lucky families. The stories I now tell include an earnest appeal, mask up, social distance. Even in the workplace, it makes for a detached work environment, but it is not negotiable. The country is now again dealing with the second wave. I and my colleagues remain ready and committed to continue telling the story. But now I am personally scarred by this virus, and that makes me tell my story with a different bias. That of a survivor. Lerato Fekisi, SABC News, Port Elizabeth.